everyone. Good afternoon. Not sleepy, right? Okay, my name is Alison. I'm the community nurse. Okay, that's why my uniform is like that. Okay, can hear me, right? Okay, I'll talk about the simple nursing care for elderly for nasogastric tube feeding. Do you have anyone at home having tube? No. Have, okay. I'll just explain a bit more. Okay, what is a nasogastric tube? So you see, it's actually a method to feed the liquid food, which is the milk, and also the pounded medication through the tube, especially for those people who are unable to take orally, right, because of stroke or because of surgery. Okay, so this tube is inserted into the nose, to the back of the throat, and then to the stomach. All right? Okay, so do not attempt to feed. If you see your loved one is coughing, vomiting, feeling restless, difficulty in breathing, diarrhea. So why? Coughing, it could be the tube has entered into the lung. So don't ever go and feed it. Difficulty in breathing, especially when the water is inside the lungs. Okay. Abdominal pain, diarrhea, usually the milk maybe it's not suitable for your loved one. Yeah, may need to change or ask advice from your nurses, home nurses. Okay, things to note. Before you prepare the feeding, first of all, always prop up. Right? Cannot lie down and eat, right? Same as how we eat at home. So in an upright position, then okay, if there's a suctioning tube, suction, that means the phlegm, there's a lot of phlegm behind the throat, suck before you feed. Suck out all the mucus in the throat. And also you can clean the mouth. Some of them, because they have no food and drinks for so many days, the mouth, the lips will be very dry. So use a sponge or like a handkerchief to clean around the tongue area, the lips, just to moisturize the lips. Okay, next we have to check the tube position. Make sure that the tape is taped onto the nose and not somewhere else on the nose. Okay, check the marking. There will be a marking tape on the tube located near the nostril. You will be able to see it. So if let's say it's loosened, it's dirty, do change it. But before the patient is discharged, your loved one is discharged, ask the nurse, how do I change the tape? It's recommended to change every day because we sweat, our face is so oily, right? Singapore is so humid, so try to change it every day. Okay, and also before feeding, always open up the mouth. See if the tube is inside. Is it coiled up, or you can see the tube at the back of the throat. Okay, that is how we check. Okay, aspiration. So next thing. If your loved one is on proton pump inhibitor, this medication is like isopramazole. I don't know you heard. It's for the stomach. It's a gastric medication. So usually when we aspirate the fluid, we have to check the pH level. They will be given a strip like this. Okay, so we have to check. So if let's say it's 1 to 5, we can feed. But patient on esomeprazole, it will be like 6 or 7. Okay, like if let's say you're worried the pH level is 7 is water, the pH level, ask the home nurse, can I feed or not? And the nurse will tell you more. Let's say there's no aspiration, cannot aspirate. Turn your loved one to the left side. Okay, so turn on the left side, push in 20 mL of air. Then pull the plunger again, pull the syringe, and check for the aspiration. If there's nothing, keep him or her lie down on the left side for 30 minutes. Just after that, you check again. Before feeding, let's say the nasal tube is blocked. Push in 20 mL of air to unblock it. It could be the milk curd inside, so just push it in, then you try again. Then during feeding, let's say it gets blocked. You see, hold the syringe, pour back all the milk into a cup, right? Then after that, try to pull back the plunger to aspirate the blockage, just in case the medication, the powder or the milk curd has stuck in the tube. Then after that, you try to feed one more time.
After feeding the tube,
No. It will be kept permanently. Yeah, like every month they will come and change. A home nurse will come.
sleeping also.
Cannot be removed because they need to eat.
Yeah, I know. I thought when you need eating time.
No.
Yeah, because in order for us to insert the tube, you must be trained to insert. Those people you cannot anyhow insert. Yeah, only those trained nurse only then they can insert.
manner must go in the shoe.
Yeah, because if not, then if you are not trained, you might insert to the wrong place. That's why you need to check the position before you feed. So
Before the patient go home and
correct, correct.
And why on the left side? Why like
Because of the stomach. Wait, because of the stomach, the shape. So you have to lie on the left side.